One of the things that we find that's very, very interesting today is where the discretionary dollars are going. So whether it's wearable technology, which I have a jawbone on, and it transmits data back to me and gives me that kind of feedback information, or quite frankly, what we think is really the future of where things are going that very few people talk about today, but everybody's going to have to reckon with, is the area of personalized healthcare. And when the $100 genome becomes available to people, and today it's worth it costs $1,000, but when it becomes $100 and it's on a card this size, and everybody understands exactly what their health profile is and their health risk profile to the absolute nth degree, they're going to have incredible demand for more services, more products, more technology, and the healthcare system today is very ill prepared for that. We see a whole new gatekeeper emerging. We think that, and I've advised young people who are going into the nursing profession, I said make sure that you concentrate in the area of genetics and genomic-based medicine, because you're going to become the new gatekeeper. You're going to be the counselors that these patients are going to need coming into the system. And you're going to be that person who's going to be able to provide the information that they're going to be thirsty for, because there's going to be more of that information, and yet at the same time it provides an enormous amount of value to know exactly what your very specific health risk is. So health risk assessments is so old school and so passé and so gone in this area of genomics-based medicine. When you know for sure exactly what your risks are and what your likelihood of contracting a disease is. And when you start to talk about reimbursement associated with that, I always like to ask this question. Well, what price would you put on a cure? What price would you put on certainty? To me, that's priceless.